the Health Front of the Week, episode 25. Hi, my name is Alejandro Fleury. I'm a certified fitness and nutrition coach with Amidst Fitness. Today's episode is called, Does Healthcare Really Care? All right. And just so you understand a little more, I want to give you a little bit of my background. I am I am a business administration graduate with a master in finance. That's what I did. That's what I did. I studied at university just because it was, I don't know, apparently like the natural thing to do to please my family, my parents, and since they are, and I come from a long extended family of healthcare practitioners. When I say healthcare practitioners, I mean doctors. They're called doctors there. They're not called even physicians. They're called doctors. So my dad is a second generation doctor and surgeon. My uncles and aunts, my cousins are third generation. I am kind of like the black sheep because I did not go into healthcare. So I decided to go and do something that was kind of random in the sense that, or that was versatile, not random, versatile. And I decided to go into business administration just because you can go into marketing, you can go into, financial services or finances, you can go into whatever, many different things, many different areas. So I did that and I went into finances, and then I made a career for about 15 years in financial services, doing a little bit of everything from account manager to financial planner, independent financial planner to wealth manager. And then I decided I had already pleased everyone I needed to please, and it was about time for me to make a name for myself in health, fitness, and nutrition. Health, all right? As you have heard me say before, there's actually one of the episodes called Dimensions of Health. And Dimensions of Health, I explain all the real variables that are involved in being 100% healthy. So there are 3 dimensions to health. So there's the physical health, the emotional or psychological health, and then there's the spiritual health, right? So, and within the physical health, there's what is commonly called the 5 pillars. And we're talking about nutrition, hydration, sleep, stress, management, and physical activity, okay? So I do coach some way, somehow on the 5 different pillars of the physical health. I also, you have heard me before say, it's very, very important, and I strongly recommend people to look into their spiritual and their psychological and emotional health. I mean, and I know that they're pretty well related, believe it or not. I mean, some people already account for the fact that you cannot really have one without the others. All that good stuff that you've heard me say before. But most importantly, today's episode is in regard to everything that we have experienced. So with the so-called pandemic in 2020, many people have actually opened their eyes to what true prevention means. And that is something that I am very grateful for, just because it has helped my business, helped many people get there. So that has been tremendous for me. Believe it or not, out of all the pandemic and all the COVID, the coronavirus and all that stuff, some good things have come out. Now, the way I see it, this has also exposed even worse, even further, what is called or known as the Western healthcare system, So the allopathic medicine. I mean, there's lots and talks, and there's like documentaries, and there's the news, and then there's like even Netflix series about like how the pharmaceuticals are going to come, like the pharmaceutical industry is going to come to the rescue one more time and some very well-known billionaires out there putting their own money into vaccines and things like that. In a parallel fashion, some other biochemists, lab technicians, as I've said before, nutritionists, dietitians, and even some doctors, like some doctors are more and more making noise about the importance of prevention. And prevention does not mean take like a 100 milligram, or children's aspirin to prevent a heart attack. That's not what it's about. Like you cannot consider prevention taking chemicals in order to mitigate or to lower your risk to suffer from something that is within your control for the most part. I don't want to say it's 100% within your control, but it is very, very much lifestyle related. Don't get me wrong. I just had a friend that had a heart attack and he actually died, and he was a seemingly very healthy person. He actually was under like a tremendous amount of stress, financial, because of everything that happened with the pandemic. It took a toll on his business, and with that his financial financial health, and eventually his health and his life. So I'm not saying that it's 100%, like your responsibility, but for the most part is. I mean, even at this point, the general surgeon has come up with like some articles showing how, it's not quoting, but about 85% of all the current illnesses that we suffer from are nutrition, and like due to poor nutrition and a lack of physical activity. So that's the reason why I do this, and that's the reason why I do firmly believe that this is the cure to the world's poor health or illnesses. It is, so, and I have seen it over and over again. And the reason I'm making this video is like, this has been a great opportunity for me to just spread the word, and it has worked, and I am glad that you're supporting me on this. But on the flip side, like after 6 years of making this my exclusive career, like just my main way of my lifestyle, I have heard so many things, and still in the 21st century, I just cannot believe how doctors keep telling clients like, it's your age, you should be, it's normal to suffer from that. Or how people say like, don't worry about your nutrition. Your nutrition is not going to do much. Just take this, this prescription and you'll be fine. Forget about the nutrition. Or how some other people say like, with your, with your condition, you should actually try and stay, calm, and don't do so much physical activity and things like that. When in fact, these people that we're talking about, these victims of that poor advice, have been like clients of mine that have demonstrated that by taking the sound nutrition, the physical activity way, they actually have made noticeable changes to their health. Noticeable changes to their health. I'm going to use one example that is a little extreme though. This one guy, 69 years old, he's achy and he's very frail. And the guy actually starts, he talks to his doctor, the doctor says, hey, listen, you know what, I think what you have is rheumatoid arthritis, so I would caution you on doing any type of strength training. By the time that doctor told him that, and he told him like specifically, don't ever lift any weight that is more than 15 pounds, which is a very, very vague statement. So it's not the same 15 pounds of your body weight than it's 15 pounds of a dumbbell curl, right? So it's just completely vague statement. So that will tell you how little this person knew about true health. This is the family doctor, okay? By that time, this person had been working, or at that time he had been working with me for about 2 years. He went from not being able to stay on a treadmill on a brisk walk for more than 3 minutes to being able to do 20 minutes of a pretty consistent walk. Number one, he went from never, ever having successfully completed something like a push-up or a pull-up, which is much harder, to actually making, doing more than one push-up and doing an assisted pull-up with up to 75% of his body weight. So I don't know, things don't add up, right? So the doctor says you have this condition, you should just rest and disregard any type of physical activity. So someone that had not been able earlier to stay active for more than 3 minutes at a time, all right, because he couldn't breathe, to walking for 20 minutes on end. Someone that was so weak that could not just move a percentage of his body weight throughout space efficiently, to being able to do a push-up and a pull-up. So where's the disconnection here? And there's another end of the spectrum, and the more I do this, the more I feel a little refreshed when I read and hear and watch about people like Dr. Mark Hyman, Dr. David Promoter, Dr. Jason Fong. When I see people like them, and they're just a few, they're just a few of them that actually have started questioning the way healthcare actually addresses health. And it does make you wonder if healthcare is the right name. I mean, this is called sickness care, and it should be called sickness care just because what they do is what, like, the Western healthcare system, what typically focuses is on mitigating symptoms and making sure that people keep functioning through chemicals for their life without addressing the root cause of what they're suffering, right? So by no means, disclosure, by no means am I claiming I cure people in any shape or form. By no means I am trying to say that I know, that I'm a health care provider or anything like that. I do believe I think of myself as a health professional, not a healthcare provider. It's completely different, all right? And I take that very responsibly, and I take that very seriously, just because, as I said, I am a third generation that descended from doctors, physicians, surgeons. So like one of them being my grandfather. Like my grandfather actually, he owned and ran his own hospital back then. It was not a small clinic; it was a full-blown hospital. So, and he was a very well-known person in his community, right? So I would not take that for granted. I don't want to necessarily make this sound as if, people like him that had the true commitment, the true passion to keep people healthy, to make them or help them regain their health. And my dad was one of them, but my dad is a very strange case in the sense that even though he comes from a pretty hard line he descends from a pretty hard line, family of physicians. Well, he actually is a pretty open-minded one. I mean, he is the type of doctor, and you can probably relate to this. The type of doctor that will say, if we haven't found the cure to what your illness is within like allopathic medicine, we have to look outside. We have to look at like naturopath, like acupuncture, Ayurveda, like whatever. He's the one that will keep his mind open. Whereas within my family as well, there's the other end of spectrum, and where they will say, well, if we haven't got to the bottom of your ailments and your it's because we haven't found the right medication. Okay, so it's a little contradicting, and it's a little heartfelt, but the truth is that I have been able to witness both. We are living in a time where And if you keep your senses open, don't just read the news, the mainstream media. Go on YouTube, type stuff, random stuff, like, like coronavirus and or immune boosting or coronavirus prevention or anything. Just come up with your own questions and throw them out there. Just go on whatever on. Geez, you know what? Go even on. There's a pretty good chance you're gonna find on WebMD some non-misleading information about what you should be doing, as opposed to trying to cover your mouth and breathe more CO2 just to prevent you from catching a virus, where like the size of the textile, or of the pores is like this size, and the size of what you're fighting is here, which is just common sense. Like one is like a micron and the other one is like a nanometer or something like that. So it's just something that it makes very little sense. As opposed to doing that, you're going to find ways to really optimize your immune function. We are not talking about sugar. For example, sugar. You want to shut down your immune system for hours on end? Sugar consumption is a way to go about it. All right, how Dr. Rhonda Patrick that I have mentioned before, like she has done extensive research throughout the whole lockdown to show like the link. Yeah, I understand, like causation. What do you call that? Like the causation link and all that stuff. I understand that, but there is conclusive evidence that show that people that have suffered the most with the COVID, they have had pre-existing conditions. I think it's 98 or 99% of them. But one thing that keeps popping up is vitamin D deficiency, like zinc. Like there's nothing to be said for sugar, and I don't know. I wonder why not. I mean, and there is like it's not that it hasn't been said. It's just that it should be mainstream information. You have to wonder, and this is the intent. This is the goal with these videos, or of these videos, is for you to start questioning everything. It's not acceptable that Fauci in the US finally at something like an IGTV, like just conference invitation, whatever it is, the guy said after almost 7 months that the lockdown has affected more so the US than many other countries, that just having your vitamin C may help. Supplementing with vitamin D may help. Seriously, there are some other professionals that don't have access to the masses like that. Like they're not widely, heard as him, that have been desperately tried to get the message across on the internet for the same 7 months that these people, government officials, have been quiet about things that, come on, between you and I, you don't think they knew this 7 months ago? You don't think they knew this 7 months ago? All right, when there are some more and more like piling evidence on how things like your nutrition, once again, and your supplementation, especially in the cases where like migrations and ethnicity come to play, and like in Canada, for example, we don't have like that full blast vitamin D supply from the sun like all year round. How do they not know that? How do they not make that mainstream information? All right, this is once again food for thought. The goal is to help you navigate through the misleading information out there and question everything. Okay, my name once again is Alejandro Flores, certified fitness trainer and nutrition coach with Altus Fitness. Please like, comment, and subscribe. All right, see you around. Bye.